It's your girl, Tassar Paris, and I'm here with another informational surgery video. Today, we are talking about fat necrosis. Super scary. I don't wish this on anyone. It's something to definitely be concerned about after getting plastic surgery. I just took some notes down just so I can share some of the important things about it with you guys, because I do know someone who ended up having that, and it was a very traumatic experience for her. It was horrible, it was horrible. It was horrible just knowing that she's going through it, her sending me the pictures. Very, very scary. So basically, the fat necrosis is the death of the cell tissue through disease or injury. So in this case, we are going to be speaking about more of an injury side, because regardless with breast implants, there's still injury taking place. Surgery's still an internal injury. So you can still deal with some of the complications after that, unfortunately. And there's so many things that are just so important to pay attention to after you have surgery, and your wound incisions. You have to pay very close attention. You have to be clean. Sometimes this just happens with your body. Sometimes it can start to accumulate if you're not as clean as you need to be, and cleaning your wounds properly with the right things. And sometimes it can be on the plastic surgeon and the surge techs, of them not cleaning the instruments properly, cross-contamination. There are a lot of things that can take place that can cause this. So make sure you take the precautions, pay attention to your body, pay attention to your wounds, make sure everything looks apart. And if you have any concerns, or you see something or feel something that's not right, contact your doctor. So I've had my breast done, and I had a great experience with it, but unfortunately not everyone has that same experience. So usually when they do the breast augmentations, they do your incision underneath your breast. That's where my incisions are. Sometimes when you do a breast augmentation with a lift, it's an incision under, and then also an incision horizontal for the lift. So with the lifts, they also, cut around your nipples. So you have that incision and wound going around, and then you have that there, and then you have that underneath. So all those areas you have to pay attention to. And basically with this, it's a lack of blood flow, which causes, your cells and all that stuff to just, what happens when you lack blood flow, it results into death. And that's why it can result into death. And that's why, or amputation, or different things like that. So that's why it's, when you Google it, it literally will say, death. Not you dying, but your fat cells are dying because there is lack of oxygen and blood flow. So you must pay attention. And some of the signs are, if you see any leakage in your incision areas, yellow, pus, different things like that. You feel a warm sensation. You might see red around your nipple area, around underneath. It will feel warm to hot. You can you'll start getting fevers. Your body will just feel like you have a horrible infection. And that's pretty much what it is. It's an infection. Now, you can have a bacterial infection. That is another option of diagnosis. But if you're having all those other symptoms, like the leakage and the warmth and the redness around it, unfortunately you might have fat necrosis. So it's a very, very scary thing. It's a very, very sad thing. And that's why it's very important to clean your wounds. Make sure you have all the things that you need. And I always recommend, because my grandmother was in the medical field, so anytime I ever got my plastic surgery, my grandma was like, look, dial soap, antibacterial, no scent, you know, the orange bottle. And I'll put it right there in the video so you guys can see. But the orange bottle of dial soap, make sure you are bathing in that before surgery. I know you want to smell good. I know you want to put a nice little scent on, but no, you really need to, you know, get all that bacteria off your body and clean yourself really, really well. And you need to make sure that you're changing your gauze and your bandages and different things like that as much as your doctor is telling you to. And you don't need to ignore the signs. You need to pay close attention to all of those signs, because those signs can cause extreme problems, extreme pain. And with fat necrosis, you don't want to go through that. Unfortunately, once you lose that blood flow, it starts caving in your nipple area, and it will start almost falling off, and you will develop a deep hole where once it gets to that state, you have to then pack it. And that is extremely scary to have to do, for you to get surgery and have to, and you're like, oh my God, I'm gonna feel so beautiful. Yay, this is the best decision I ever made. I have new boobs, new titties, and then it results into you having to pack your wound. And when I say pack, you're using like gauze, you know what I'm saying? Like it's, well, whatever the medical packing is that they give you, they have different things, but they're packing it and you have to clean that, and you have to do that at home. So it's like a really emotional like topic, because it's like, oh my God, it's so scary. It's like very scary. And it's very traumatizing for the patient. So I always will recommend, if you feel any warmth, if you see any redness, if you feel any lumps, any pain, you see any yellow discharge, you see any pus, any of that, you have a fever, go immediately and get checked. And if your plastic surgeon is not doing his job by making sure your health is in the best, you know, condition, then you need to go to the ER. Because you know one thing, the ER is definitely gonna figure out what the problem is at that very moment. And unfortunately, these are some of the out-of-pocket expenses you might have to prepare for. You never know what comes out of plastic surgery, so you have to prepare for, you know, if this kind of thing happens and it doesn't go as planned, and you have to, you know, pay hospital co-pays and pay for your medication and pay for, you know, even in some cases it doesn't heal properly and it will cause like deformation, where you have to end up going to a reconstructive surgeon, and that's 10 times more money. So always take into consideration that infection can happen. And if you feel anything that doesn't feel right, make sure you immediately contact your doctor. You'll know when something doesn't feel right in your body. You'll know when you see something that doesn't look right. Pus, I mean, like I said, any of that discharge, it should be a huge red flag for you. And I'm just trying to look at some of the things that, if I didn't cover anything. Yeah, so pretty much they'll do like a culture and they'll see, okay, I mean, it's almost, you can identify it, you know, just looking at it, but they will do cultures to confirm that yes, it is fat necrosis versus a bacterial infection. So I hope this video helped for anyone who, you know, is thinking about getting a breast augmentation, or they've had one, or they want another one. This is something you definitely need to just pay attention to. In most cases, the breast augmentations work really well. Like you don't deal with this. It's common, but it's not super common. But once again, you need to pay attention. So I hope this video helped you guys. Thank you so much for tuning into my channel of all my informational beauty procedures, cosmetic procedures. I'll be back with another video. I have an amazing topic I want to talk about that I don't think a lot of people know about. So thank you so much for tuning in. Once again, it's your girl Tassara Paris. Make sure you subscribe, hit that like button, leave a comment.